Okay, so we are live. It's Fort Myers, Florida. It is Dr. Scott Geller, mid-February 2018. We have a doctor here, a DO, medical doctor, emergency room physician from
Yes.
Ohio, correct? And I initially saw you, it was what, last April, something like that? Last April. And last April, we did 2 laser sessions, and you had a very unusual situation. I should actually run that. Well, we'll run the video maybe simultaneously if I can edit this. But you had asteroid bodies, which I thought were some of the densest I had ever seen. And I told you that in advance.
Right.
And I told you that maybe a 50-50 probability of improvement with this because they sometimes respond, sometimes they don't. But your initial experience was a positive one, correct?
Correct. There was more light coming through.
Yeah, there was more light coming through. And we had to sort of stop the sessions because you had a slight elevation of pressure, which we treated with eye drops. And like the majority of those cases, the intraocular pressure will go back to a normal level in maybe 3 to 6 months. It takes that long. So it's been 10 months or so since I saw you, and I did a laser session yesterday. And what was your opinion of the difference?
The difference was much more dramatic than the first time back in April of last year, in that you created a window. So this large cloud that completely obscured my vision now has just a few floaters in the way.
Well, yeah, and what's amazing to me is that
I have complete light coming through.
Is that your asteroid bodies lie below the midline. I haven't quite seen a case like yours ever, I don't think. But
That's what you said.
we did 2 laser sessions. Hopefully, we created a greater window. If you ever do develop something like cataract in the future, I think a vitrectomy at the same time simultaneously would be the thing to do to really, really get things better.
Right.
But you could have had a vitrectomy before. You chose not to do that. You would have had cataract induced and had to have a second operation. But you're happy with the result, right? That's the bottom line.
Yes, because now I have depth perception is returned.
Right,
And
and
that's everything for my job as an emergency physician.
Yeah.
In terms of sewing and intubating and doing procedures. So
great. That's
not
super.
to mention golf. I can now see a ball.
Okay.
And tell where it's at on the ground.
Excellent. And I told you I was actually invited to give a presentation before the Osteopathic, Ophthalmological, and ENT Association, which is meeting here in Florida in Bonita Springs in April of 2018. I might just use your case as an interesting example of what can be done.
Yes,
And hopefully in the future, there'll be young ophthalmologists who'll take the ball and run with this. I can't be doing this forever like anybody. Hopefully
No,
we'll leave a good
but
legacy.
it's a wonderful thing because it's made the difference in actually having sight in the left eye. Now I can actually get probably 20/20 if I increase the...
Yeah, and by the way, I forgot to mention that initially, I think, what did we say your visual acuity was, 20/40 or something like that?
Well, originally last April I was back at 270.
20/70.
With correction.
And with clearing this little window, your visual acuity went to 20/40, 20/30, something like that, which is a big difference.
It's a huge
big difference.
I think it'll go even better since yesterday's treatment.
Well, you'll let me know, and I hope so.
Yes.
You're a great patient. Have a great trip back. You have a lovely spouse.